So as you possibly know, the Global One Health Network is a network of researchers in health sciences and in social sciences that are working together to try and better understand how the governance regarding infectious diseases and AMR has been going forward, both in Canada and in the world, specifically when it comes to the One Health approach. And One Health is a very good idea. A lot of people are totally behind it, but operationalizing it, making it work is very difficult. So today we again are very happy to have Cheryl Stroud, who's a veterinarian with a PhD in endocrine physiology and a passion really for this urgency of implementing One Health thinking and the One Health approach to improve the world and for our future. And the time is now, and I think we're both on the same page for this. So she's had the experience in the industry, in private practice, in academic research and teaching, and also is a One Health practitioner. And she is the executive director of the One Health Commission since 2013. So the One Health Commission is a 501c3, in other words, a nonprofit organization in the US that is chartered in Washington, D.C. It is headquartered in the central part of North Carolina. So amongst the many volunteer things that the Commission has done, so in 2016, the Commission spearheaded the creation of an annual Global One Health Day, which takes place every year on November 3rd. The Commission also leads a Global One Health Month every, Awareness Month every January, which provides One Health resources for advocates in social media outreach and to teach about One Health. So one of the things that Cheryl really advocates is education about One Health, but starting at very young ages, all the way to university, and why not elderly people? So, so Cheryl, thank you so much for doing this for us today, and I'll give you I'll let you speak. And at the end, we'll have a question session. So please use the Q&A or raise your hand if you want to speak at the end, but do not use the chat. Please use the Q&A instead. Thank you. So Cheryl, the floor is yours. You're on mute. Here we go.
Okay, you can hear me now. And are you seeing my slides in full screen? Excellent. Thank you so much, Hélène. I am thrilled to be connected with the Global One Health Network and getting to know you guys. I've been kind of tracking what you've been doing for quite a long time. So it's a pleasure for me to get to be part of your conversation. So I bring you greetings from the One Health Commission. Let me figure out why we're not advancing here. As Hélène mentioned, we are a 501c3 nonprofit licensed in Washington, D.C. I have to make a correction right off the bat, though, Hélène. I did not start the One Health Commission, and this is what you're going to learn in our discussion here. It's going to be fun to kind of, I usually, in fact, I actually have a slide on this. I usually am talking to people who don't know much about One Health. So this is a real treat to get to talk to people who already understand the concept, and then to really talk about our needs in this One Health movement. So the commission was actually founded in 2009, and we're going to talk about how that came about. I want to just comment, Hélène, that I will provide these slides, a PDF of these slides, to the group. if interested, because I have tons of links included on the slides. If anyone wants to go get more information or learn a little bit more, then I'll be able to just mention in passing here. So we are headquartered in North Carolina. I refuse to pay bricks and mortar rent space, so we're headquartered out of a dedicated office in my home. And we're so far funded by organizations that believe in this concept of One Health and what the One Health Commission is trying to do. So our mission is to educate and to create networks that will work together to improve the health and well-being of humans, animals, and plants, and promote environmental resilience. We have a very lofty, exciting vision that we envision a world in which the interconnectedness of animals, environment, plants, and people is deeply and systemically recognized, valued, and acted upon in all decision-making processes. Wouldn't that be lovely if our One Health way of thinking were actually the default way of doing business at all levels of academia, research, government, policy? So that's our vision. And we'll talk a little bit about it. These are some of the organizations that have actually financially supported the commission. Although, as you guys are probably aware, there's never quite enough. So we're always very happy to talk to anybody about this concept. There's no paid membership required to participate in any of our activities. We just ask for people to support us if they can. And as you guys are all aware, none of us in this movement are doing any of what we're doing alone. One Health movement has not evolved in a vacuum. We're all standing on the shoulders of many giants. And I just mentioned here Calvin Schwab and his books, and James Steele and this book about James Steele. And it's very regional. If we were in Thailand or over in that part of the world, we would have kind of a different, we would have different champions and leaders that we would be saying thank you to. If we were in Bangladesh, it might be Nitish Debnath, or if we were in India, it might be Prejeet Nambiar. So there are champions in each region of the world. And the story I'm going to tell is how the commission came to be and what it's trying to do in this movement so that we really can join hands across the movement. But I just wanted to make the comment that we're all standing on the shoulders of giants. None of us have done anything that we're doing in a vacuum. In fact, I would just challenge you to kind of track the One Health movement a little bit, to kind of put in context, kind of an environmental scan context of how the commission evolved. If you go on the commission's website, one of the things we've done is try to, for the benefit of the world, to track how the movement has evolved. So we have put events, even very, very far past events, starting in 2001, that started to show the emergence of this One Health conversation and this movement. So if you go to this webpage, and I've got the link here for you, if you go to this webpage and you click on the year and then click view, you can literally track the progress of the number of events that were starting to evolve and be held around this One Health conversation. So I urge you to do that, because there were things happening even in like 2001, 2002, 2003 that that foreshadowed, I think is a good word, foreshadowed the movement to come. In my mind, the movement came out of the biodiversity and conservation medicine realm back in the late 90s. So just to set that stage for how the commission came about. And just, in fact, in 2006, Tom McGann, a veterinarian working for Homeland Security in the United States, started this One Health Academy discussion series in Washington, D.C. that continues today. But just kind of setting some environmental scan context for you. So another one of the giants whose shoulders we're standing on was Roger Marr, who called with, he was the president of AVMA in 2007. In 2006, he called for, through the AVMA, he called for the formation of a One Health initiative within the American Veterinary Medical Association. And he happened to meet that year Ron Davis, who was president of the American Medical Association. And the two of them joined hands with a colleague from the APHA, the American Public Health Association, and created this One Health Initiative task force that grew to a force of about 13 people who met together over the period of a year. Back in that day, it was by teleconference, to talk about what needed to happen in this One Health space, because there was starting to be more and more recognition of this concept of One Health and what should we do about it. So that's really that One Health Initiative task force then a year later or so, it released its executive summary to the American Veterinary Medical Association. And in that executive summary of their conversations, they made 12 recommendations. One of the recommendations was the creation of a One Health Commission that would make it its business to really focus on this One Health concept and bringing it forward and furthering the concept. I think at the time they were thinking national, just the US, but very quickly the One Health Commission's board said, no, we need to work globally. And as we talk, you'll see why we felt urgent about that. So we really very early on started working globally. So that's the context of how the commission was started. It wasn't me alone. So I actually showed up in the picture just about that time also in a parallel initiative, the One Health Initiative. My colleagues Bruce Kaplan and Laura Kahn and Tom Anath and a whole group of them were also starting to work together and launched a One Health Initiative webpage that has done great grassroots effort to educate about One Health around the world. They're not a nonprofit organization. They're a group of individuals who have done all this out of their labor of love. And it's been a really wonderful collaborative partnership to work with those colleagues. On this slide on the One Health Initiative, you'll see that, back in 2006, Laura Kahn had written this paper, Confronting Zoonoses, Linking Human and Veterinary Medicine. And it was that paper that Bruce Kaplan saw and reached out to her. And that's how the One Health Initiative came to be. So they launched their website in 2008. So all this is kind of happening about the same time and not necessarily even in communication with each other. So that just lays some of the context. And then we're trucking along, and by 2009, Carol Rubin, who's at CDC, she has created or been able to start a One Health office at CDC, which has also emerged and evolved, and is quite an active office now. So that kind of sets the context. Also going on out of the United States, in 2009, the USAID launched its Emerging Pandemic Threats Program, which went to work in Central and East Africa and in Southeast Asia. And Dennis Carroll, the gentleman who started that and was leading it within USAID, framed everything in One Health. And you can literally, the reason I've got this map down here in the bottom right corner is you can literally see on the One Health Day maps where those One Health efforts of the USAID Emerging Pandemic Threats Program were taking place here in Southeast Africa and over here in Central and East Africa and Southeast Asia. So, I'm just trying to help you understand that none of what we've done in the One Health space has happened in a vacuum. There have been many parallel initiatives going on that are bringing us to where we are today. So back to the commission in 2008, after that report was released, they stood up a One Health Initiative steering committee that would actually make the One Health Commission, create the One Health Commission. And from 2009 to 2013, Dr. Marr, who was took on the leadership at that time of the commission, was doing all the background organizational backbone things like getting the bylaws written and getting a nonprofit license in place in Washington, D.C., and setting up a bank account. And there's a lot to be done if you're starting a nonprofit. Rockefeller also stepped in and helped. They wrote a proposal to Rockefeller, who helped with some funding. And the American Medical Association helped with some funding. They were involved at the time, but unfortunately, Ron Davis, who was the major champion for One Health within the human medical arena at that time, unfortunately, he died in 2008 of pancreatic cancer. So we lost a huge champion in the human health arena. back in 2008. He actually made a resolution happen within the American Medical Association. Actually, it happened ahead of the AVMA's resolution within its organization to incorporate One Health. And unfortunately, with the passing of Ron Davis, much of the support for One Health within the American Medical Association has gone to the wayside. That's just giving you more historical context there. I kind of got involved myself in the One Health movement when I was able to help start a North Carolina One Health collaborative here in North Carolina. And that was launched in 2010. And it's kind of what we were doing in North Carolina is what brought me to the attention of the One Health Commission. And I was nominated to be on the board as a representative for the American Veterinary Medical Association, and then asked to lead the board in 2013. So I'm just giving you all this context. But what it all boils down to, and what you were saying, is we all get this concept. We know we need it. But what do we do? How do we make it happen? That's the challenge for all of us that are working in this space. So there are things that we are doing. There are wonderful, exciting things going on. The Commission is just one of many organizations that really has stepped out to try to lead and help further this. So as Hélène mentioned, we're all about educating at all levels of society, cradle to grave, about this One Health concept. We feel like if you wait till university level, it's too late. We really need to start instilling these attitudes about our human place on the earth very early, So we have a One Health education effort that's really focused on doing that. We really want to synergize and potentiate all efforts around the world to further this One Health concept. And we do that by trying to connect the global One Health community, by creating transdisciplinary teams and partnerships that work together to educate about One Health. And we try to provide opportunities for individuals and groups, organizations, especially individuals who might not have an opportunity to actually lead and do something in this One Health space, to get involved in working groups. And we really find that we absolutely want to facilitate and support in any way that we can any efforts of any One Health group anywhere around the world that's working to further this concept. So that's kind of what we try to do. Why? Because, well, we first noticed that nobody was doing this, trying to connect us when we first started this back in 2014 or so. Nobody was trying to help figure out who's doing what, where in this world for One Health, so that we could join hands and do it together. And we really felt like creating strategic networks, and we've actually become a network of networks, could help us find each other to join hands and raise our collective voices on this topic. And of course, we've already mentioned why education is so critically important. So you'll notice we use this mantra: connect, create, educate. Those are our strategic priorities, and that's what we always are trying to do. So on that front, for connection, one of the things we started trying to do back in 2014 was identify who's doing what in the One Health space. And it very quickly became so large that we had to break it into maps of academic institutions, government agencies, and intergovernmental organizations, and nonprofit organizations, and for-profit corporations. And I hope that you'll go and visit these maps, because we know they're not complete. Almost weekly, some new organization comes online. So we hope that you will visit that. And some of the things that we've done on this front is to lead a webinar starting back in 2014, the first International Who's Who in One Health webinar that we led, and then another one in 2016. We helped facilitate the launch of this International Student One Health Alliance in 2017. We had actually started bringing students together back in 2015 when we did the first Who's Who in Students for One Health. At that time, we were just calling it SOH, Students for One Health. We launched, a group of the students felt like they needed a logo for students. And so we facilitated and supported their logo competition. And that's how the ISOHA logo has come to be, is from that logo competition for student groups that emerged in 2015 and 16. And then a group of students stepped forward to really create an International Student One Health Alliance in 2017. So this is just some of the history. In 2016, I had bumped into Ab Osterhaus, at the time was leading the One Health platform in Amsterdam. And in about 60 seconds, which is about all we had to visit, we said, we should join hands and start a Global One Health Day. And so that was in November or September. It was late in 2015. In 2016, we worked together and pulled the One Health Initiative in, and the 3 groups launched the One Health Day. And I'd like to point out to you guys that One Health Day events do not have to happen just on November 3rd. They can happen anytime during the year, but we would beg you to go and register your events. Like a lot of your events that you guys have held need to be registered and get a pin on the map for the Global One Health Network for One Health Day. So I now need to form up the map for 2023 because the events are still coming in for 2023. And it's been really exciting to be part of that and to see how the world was actually craving an opportunity like this, to have an excuse to lead something in their area to educate about One Health. So it's been really a fun ride with the One Health Day. Part of that we built into it, and I actually have to say this was a One Health Platform's idea. We built into it the student competition. So that's been another fun thing to have, to give students an opportunity to deliberately create teams that are transprofessional, that have human health, animal health, environmental health, and some other, not necessarily health related. It could be chemistry or anthropology, a student from some other realm to lead these. And if they wanted to, they don't have to, but if they wanted to, they could submit their events, write a report, how they planned it, how they executed, and compete for cash prizes. So just making you aware of that. We really felt like it was so urgent to share news of what was happening in the One Health space all over the world, to pull it together and share it. So that's how the One Health happenings emerged. The first one we did was it didn't look anything like it does now. It was in 2014. And then you can actually go on that page, this One Health Happenings archive page, and you can go and look at some of what the original ones look like. It really was an evolving work in process, but it has become, my sense is that it's grown to be quite appreciated by people all over the world. I am hoping that we can find better ways to really connect and share information. Even what we're doing now, we know it's incomplete. We find out every day some organization had an event that we didn't know about, and we would have been happy to highlight it and to shine a light on it in One Health Happening. So help us with that. It is a community effort. We realized, you guys will notice that a lot of what the One Health Commission has done is it's looked around and realized a gap and then tried to do something about that gap. So one of the things that we realized here in the US or in the Americas was that nobody was teaching children and parents that bats could carry rabies, that no, not to touch a bat, to teach children if they see a bat on the ground, don't touch it. So we stood up this bat rabies education team. That was one of our very early education efforts. We looked around and realized nobody was trying to help bring social scientists into this One Health conversation. So we launched the One Health Social Sciences Initiative, which is still very active. And I'm so proud of that group. And I'll just mention in passing, all our working groups they function pretty independently with our support, and we don't tell them what to do. We often bring suggestions. And of course, everything they do, we've got to make sure it's the board and the One Health Commission is happy with it and pleased with it and feels that it's appropriate. But that's the way our working groups start up, usually by somebody coming to me at the commission and having a fire in their belly, a passion for some issue that they want to bring forward to the world. And that's how we stand it up. One of the subgroups of our One Health Social Sciences is a group working on food safety and food security from a One Health Social Sciences perspective. So that's been fun to watch. It's a very new group. It's actually being led by a young lady in Jordan, and their webpage is under development. So we haven't actually got their webpage fully activated yet, but they've been leading all sorts of international One Health Social Sciences framed food safety and food security. So watch for that. And as I mentioned, one of the really exciting, cool things I've been able to do is meet amazing people all over the world who are out front leading. for One Health. And so the commission cannot take any credit for the One Health Latin America, Ibero and Caribbean, the OLAIC group, but I can take credit for introducing the people who made it happen. So Christina Pettenbrewer and Daniela Figuera, I actually introduced them and said, you guys, there's so much going on for One Health in Latin America that the world doesn't know about because of the language barrier in part. So we started trying to find ways to bring those people across Latin America together, and the One Health, the OLAIC group emerged. And since then, more things have emerged. But this language barrier thing is just very frustrating because there's really a lot of wonderful work. There's a really wonderful One Health group in Colombia that the rest of the world's really not aware of because everybody doesn't have Spanish and everybody doesn't follow their Spanish-speaking Facebook page. So we have to find ways to overcome that challenge. On the education front, our One Health education group right now is really focused on the U.S. We have been involved in some international things, helping to launch the One Health for One Planet education initiative, which is now being led by George Lodicki over in the UK. But here in the US, one of the things, many things that this group has done is to set up a teacher survey where they have a survey that literally is being used as a teaching tool that has been pushed out to teachers, K-12, primary, secondary teachers, asking them questions to help lead them to this idea of One Health and to realize how important it is. And then the next, one of the things that we dream of doing is doing teacher workshops where teachers could come and I don't know, maybe get a One Health teacher certification for primary, secondary or something, so that teachers could find ways to incorporate One Health into not just health education. In fact, that's a huge challenge, what students are getting in the way of health education. There's not much, but in every topic, in every subject, starting very early. So that's what we're doing on the education front. We've also done a compilation. You'll find this on the webpage, a compilation of all the things. We realized there were so many things out there that had already been created to teach in this, even for earlier ages, to give One Health framed educational lessons. And so nobody knew about them. They were all over the place. So we started trying to pull them together in one place where people could find them. And so it's a resource that we have, it's a labor of love that we've pulled these things together so people could find them, especially as K-12 teachers come into this area and want to get involved, they can go find lessons. So, and then as Hélène mentioned, I don't have time to tell you the story of how this evolved. It happened to do with Deb Thompson, who was a congressional fellow in Washington, D.C., back just before the pandemic hit. And she was actually able to help get One Health Awareness Month onto our congressional calendar for the Senate. It never happened in the House. But we took that opportunity to kind of launch a One Health Awareness Month, which amazingly to us has been picked up all over the world. And now in January, people are celebrating One Health Awareness Month all over the world because we put this calendar together. And I hope you'll go and visit this because we put together a ton of resources for people to just pop in and grab something and go post it on their social media to help educate and make noise about One Health. So I hope that you'll check that out. It's just another resource. As I mentioned, we feel that nurturing the next generation of One Health leaders is critical. It's so important. So, the One Health, the International Student One Health Alliance has been created as an independent organization. We don't tell them what to do, but we do try to work kind of joined at the hip, working closely together. Also in support of nurturing the next generation of One Health leaders, we were able, with Georgia Aquarium's support, after Dr. Bossert passed away just early on in the pandemic, we were able to launch Greg Bossert Memorial Scholarship, which again is, to me, it's just been one of the most fulfilling things to do. We've just announced Mehek Hafiz, who is over in India. She's actually in that Kashmir area, which is actually a contested territory between Pakistan and India. And she's doing research on harmful algal blooms. And she won the award this year. So it's just such a pleasure to get to support these young people who are just cutting their One Health teeth and realizing what it means for what they're working on and figuring out what they can do with where they are and what they have. And then other things that we've been able to launch is this map showing the countries around the world that we are aware of that have formally adopted national One Health strategic action plans. I've said this to Hélène and a few folks in your network that I visited with. It is rather distressing to me that there is no country colored green in the Western Hemisphere. Colombia is working on it. The US is working on it. We'll talk about it briefly in a moment. I think Canada, you guys are working on it too. But this is a very difficult thing to do. It's been easier on the AMR front to get One Health framed antimicrobial resistance action plans in place. So you'll see the map there has covered a lot more countries. But I'll hope you'll check out that resource because we've actually posted on those pages links to the national action plans, and they can be very informative for those of us who don't have a national action plan yet. We try to bring opportunities in the One Health space forward, share them with the network. We've created these bulletin boards that I hope you'll go and check out. Especially popular are the summer programs. I notice a lot of people visit the summer programs and the master's and PhD programs. We put together a page of all the tools and One Health tools and toolkits we were aware of. If you become aware of some that we're not aware of, please let us know. This is a community effort here that we're doing, trying to bring this information forward to the world. And also, we were able to put together, this was Neil Vizot's MPH capstone project, was to put together and compile curated resources for faculty at schools of public health who are in the US. They're mandated to be sure that their MPH students come out aware of and understanding this concept of One Health. So we just put together some resources to help the faculty of schools of public health do that. But these resources are freely available to the world, and we're finding that other arenas find them very useful also, whether they're coming at it from public health or environmental health or whichever arena they're coming from. We also have tried to pull together all the publications that we were aware of that focus on the core competencies for One Health. This is incredibly important if you're working in academia. So make use of those lists and the economic benefits of One Health. Many publications about that. This can be especially helpful if you want to go talk to a lawmaker or a policymaker, and you go in with a whole list of publications about the economic benefits. I kind of feel like on the legal front, if the facts and the publications about all the reasons why we should do this don't talk enough to get it to happen, then the money might. So we can actually talk about that for quite a while. We have a library of information that we've compiled to help the world understand this One Health space, all the way from highlighting individual publications to books and reports. I hope that you'll go and take a peek at this, even social media platforms that come forward. And I wasn't sure where to insert this, but it's kind of along the lines of sharing One Health knowledge and best practices. But when the pandemic hit, guys, I was overwhelmed. I had so many speaking engagements. The world was suddenly waking up and going, oh my gosh, is this what we've been talking about on One Health for all these years? And so it was tons of groups were wanting to hear about One Health as the pandemic was progressing. So, and we also noticed that there were so many popular media op-eds and commentaries being published around the world that were calling for One Health and trying to help people understand why we need this. So we just started grabbing them and just putting them in a place where people could find them. They're well over 350. I haven't even counted them recently. They're still coming out, not so much as they did early in the pandemic. I just wanted to make you guys aware of that. And then to give you a little more environmental context for here in the US, back in 2003, Joe Anelli was working for USDA, APHIS at the time. And he was able to pull together people from all across our agencies who were interested in One Health. And especially when the avian influenza, that first 2003 avian influenza scare was happening, starting that conversation across US federal agencies. So he was able to form, it kind of became a little more formalized in 2014, he kind of a little more formalized it as a federal interagency One Health working group. It's still very informal, no funding for it, just would bring together people from different agencies to talk. And that has emerged and evolved. It was when he retired, he kind of tossed that ball of leadership to Casey Barton-Verovich at CDC, who now leads the One Health office at CDC. And for a while, they referred to it as the One Health Federal Interagency Network. And then when COVID hit, it became the Federal Interagency COVID Coordinating Group. So we'll mention a little of that again. Kind of parallel to your Royal Society and the One Health group there, and the paper that you guys publish, our National Academies of Science, Engineering, and Medicine, and its Forum on Microbial Threats has a One Health Action Collaborative that was actually started by Jonah Mazzette and some of the people within the forum who were on the National Academies who understood One Health and our need for it. So if you'll visit that page, you'll see a lot of the activities that they've done. This core competencies, this is just one of their activities, is publishing a paper about One Health education and core competencies. And what are we missing? Why are we having so much trouble here? And then I just mentioned this in passing because I hope that you guys are aware of it. If you're not, I hope that you'll take advantage of it. In 2018, before the pandemic, the Smithsonian Institute launched this outbreak exhibit that's totally framed in One Health. If you've gotten to DC, I hope you got to go see it before it closed down in real life. It was a whole thing of the Museum of Natural History dedicated to this, helping the public, and they think like 3 million people actually got to file through there before it was, even with the pandemic shutting things down for a while. What I want you to know about this, though, is that this exhibit was prepared in a travel version. So they call it the pop-up version. And you can bring this to a location near you, bring it to a library or a hospital lobby or your academic institution. You can bring it. They will provide it to you free. All you got to do is come up with a few dollars to print it in whatever format you want to print it and find the places to take it. So that continues, and I hope that you guys will take advantage of that. We have had a number of states here in the U.S. Actually formally adopt One Health Day or One Health Month, so that's been fun. New Jersey is actually one of the first states to actually legislate a New Jersey One Health task force, so they've been putting that together now for a while. We've been able to lead at least one webinar. We hope to do a whole series of them, but there's just too much to do. We can't get it all done. But back in 21, we led a One Health 101, What's All the Fuss webinar. And this one was actually kind of targeted to the staff and the lawmakers. It was open to the public. We were educating about One Health, but we really marketed it in that group, trying to help our lawmaker offices understand this. Our APHA, American Public Health Association, wrote a beautiful policy statement. I think it was actually mostly penned by Catherine Mishalaba, that you guys may know from Eagle Health Alliance. She's been very strong leading in the One Health space for APHA. And over the years, what used to be a veterinary public health special interest group grew up to be a One Health special interest group, and then it grew up to be a One Health section within the APHA. So that's been very exciting to watch, to see how One Health is beginning to be understood within the realm of public health. It's a huge climb. And other organizations, of course, more and more are coming on. Our AFWA, the Association of Fish and Wildlife Agencies, has taken up recently a One Health initiative, and you go and check out some of their things. And then on the advocacy front, I'm not going to have time really to go into very much of this, but the links are going to be here for you guys. One of the things that we were able to do back in 2015, when one of the first times for this to emerge publicly to our lawmakers, was a group of senators wrote a letter to the Obama White House urging the creation not just of a U.S. One Health framework, but an international One Health framework, which has been kind of fun to watch how the quadripartite now has evolved. But the commission did write a letter in support of that and helping make people aware of this call that these senators had made, and got a whole lot of groups and organizations and individuals to sign on. So that was one of our early advocacy efforts. But then in 2016 and 2018, we had bills introduced just into our Senate, and not in a bipartisan way, but it got One Health into our congressional record. So that was exciting. in 2019, we had, in a bipartisan way, this is the first time this One Health was brought forward in a bipartisan way and into both of our lawmaking chambers, both the Senate and the House. So that was very exciting. And we took that opportunity, the commission did, working with the American Veterinary Medical Association, the AVMA Government Relations Office, to create a very informal coalition of organizations in the U.S. that supported One Health and at the time supported this bill. So that coalition is still open for groups to join. And we bring them up to date, sharing information, especially, if you're busy working in your own little space, you may not know what's going on in the bigger picture for One Health or legislatively. So that's been very fun to at least be able to share that information. And if we could push it, I'm sure that this coalition would just explode because, One Health came to such the forefront with the pandemic. It was reintroduced again in a bipartisan way into both chambers in 2021, and it was calling for the U.S. to establish an interagency One Health program. So I got to talk real fast here so I can tell you a couple other things before we open up for questions. California is another state that has actually adopted a One Health framework for its structures, and I'm anxious to hear. I haven't had any updates on this recently, how that's going in California. I'll just skip over this one. Our National Biodefense Strategy that was released in 2022 also had One Health was filtered all through it. You can actually go and take a look and use Control F and search, and you can see every time One Health is called for, and see how our people working in biodefense are beginning to realize the need for this interconnected approach where we really have the animal health and the environmental health and the human health folks all working together. Last year, at the end of the 117th Congress, I guess it was, a group of us from the One Health space had been advising Senator Gillibrand. She is a Democrat from New York, and she brought forth a bill called the One Health Security Act. I have no idea where it's going to go or if it's going to go anywhere, but just to make you aware, and you might want to go check it out and see what it was suggesting. It was actually bringing forward, this one had some funding attached to it, which all these previous bills had no funding attached to them. They were going to be unfunded mandates until something major could happen. But this one would bring funding, and it also offers a structure for how, in the U.S. anyway, our federal agencies could better coordinate and work together. Not to take anything away from any agency, just to help us work much more efficiently by joining hands and doing projects together. And then some of you might have been following that back at the end of 2022, a huge omnibus bill got passed, and formally written into the language of that bill was this call for CDC to lead the charge to create a One Health framework along with other agencies, to work with all the other agencies to create a real version of this One Health framework. So that has been brought forward just in September. It was open for comments here in the U.S. From September 20 to November 6. So we've just gone through a period of comments. Again, it was mandated that this framework be suggested, but there were no funds attached to it. So who knows how this would all go. And some of us feel like we still don't know quite enough about it. So that's just to kind of bring you up to date what's kind of going on the advocacy front. So we were able to help, bring some folks together to coalesce some comments so everybody could say, oh yeah, I was thinking that too. And then they ended up making those comments about the framework. So I just want to highlight this for you because when the One Health high-level expert panel came up with this new definition for One Health for the quadripartite and for the world, the major issues here are collaboration, communication, coordination, and capacity building. And some of us in this space feel like we're not doing very well at the collaboration, communication, and coordination piece. We really have a ways to go, even within the One Health space, to be better connected. So this is why I titled today's talk, Joining Hands Across the global One Health movement, because I think that we need to do better on those fronts. And On that note, last year in Singapore at the World One Health Congress, a group of us had put together an abstract that actually got accepted, and I traveled to Singapore to present it. I hope you might go use this link down here to actually listen to it, because that's what we were calling for. We were calling for those of us in the One Health space to do a better job at sharing what we're doing, be better connected, better communicative, so that we could all know what we're doing and find ways to join hands. So we were not calling for another nonprofit. We were calling for those of us in this space to do a little bit better at coordination and communication. So maybe go and listen to those comments if you have a few minutes and see if you agree and how we could start to do this. I guess I just want to point out, because I know we want to save some time for comments, there's still so much to do. Like right now, there is a group at Colorado State University who realizes that just academic institutions across the US or in the Americas, or just starting in North America, really need to be better connected in this One Health conversation. So they're trying to start a conversation among academic institutions. So we've been trying to do it globally, trying to show the world who are the academic institutions, who are the nonprofit institutions doing this work. So just to make you aware, because I know a lot of you are from academic institutions, and they may be reaching out to have your academic institution be part of their network. And I'm hoping that we'll do this together. But I just said this to say that there is still so much to do. We've done a lot in the past 10 years, but we're barely scratching the surface. So there's so much for us to join hands and do together, in whatever way, shape, or form we can figure out how to do it. So it really is a matter of how can we join hands to really keep this momentum going so that we do move toward our vision for the world to make One Health the default way of doing business. So thank you very much for listening. And I'm thrilled to chat with you guys and hear what you're thinking.
Wow. Thank you so much, Cheryl. I can't imagine all you've done, well, all the commission that's done. And like
all with volunteers.
Yeah, and about
these are volunteer working groups. And one of the things I really wanted to highlight is it all depends on the leaders that step forward. Yeah. And the fire in their belly and their ability to give it a long-term commitment, to lead working groups, to just kind of make a force amplifier, if you will, just to keep spreading this way of thinking.
Yeah, absolutely. So I'm going to open the floor to questions. Please use the Q&A or raise your hand if you have a question. I'm not sure I'm going to see all the hands, so you can also put the note in the Q&A to let me know if you have a question, comment. Okay, so far we don't have any question. Well, Christina, you must have a question. You always do.
I was actually just all to sleep.
Yeah, I was actually just writing a question. Thank you so much, Cheryl, for that incredible presentation. There's just so much there, and I think that we'll spend some time unpacking the PDFs and connecting with all of that. I guess I wonder, I mean, there's so many questions to ask. So one is, what would your guidance be or your thoughts be about kind of the timelines of engaging with government around that? This has taken since 2008, or I mean, is it just completely random, or is it luck? Do you actually have a strategy and doggedly plug away for 20 years?
The first thing I'll say is that no one group or one person or one anything is going to make this happen. A lot of what's happened across the US has happened because a lot of people have been working on it for a long time. And these things do take time. So, you've seen, we have a lot of people in our agencies that understand One Health, and they try as best they can within the statutory authorities and the structures that they have to work in. They try to do that. But there's no way to put something like that on a timeline. It's just a matter of doing what you can every chance you get to raise awareness. And when we think of education, we think of it not just for children or adults or old people. We think of it as a huge thing for lawmakers. We're also, the public to us is the lawmakers and policymakers too. So, so it's just a matter of education. And I guess until I got in this One Health work, I had never gone to speak to a lawmaker. And then I realized that I was going to have to get comfortable doing that. A lot of people are not comfortable going to talk to their representatives or their senators or even at a state level. So once you do it a time or two, you realize that they're just people too. And they're actually quite thirsty for relationships that can inform them on things that they have to vote on. So, once you realize that these people that are in these offices of our lawmakers and policymakers, they're thirsty to know who they can call on for information. Say this One Health bill comes up and they want to know more about it. If you can, as a group, go all to your lawmakers and wherever you are in your country and just establish a relationship. Hey, I'm a veterinarian here, or I'm a physician here, or I'm a public health worker in this public health department. I just want you to be aware of this One Health concept and what we're trying to do here. If you have any questions, I'd be happy to talk. Something as simple as that can go a long, long way. But there's no timeline.
Yeah. I mean, I guess, the timeline is certainly not 4 years from announcement of a grant to the end of it, the end of a network. So that's kind of a message to us. I guess one of the take-home messages that's, I think, is that we haven't in Canada gotten really as well as we might in the health field is actually that knowledge users isn't synonymous with technical staff of ministries of whatever sector, that there's a political dimension, and that they're political actors at national, provincial, municipal levels, and they're also social actors who aren't necessarily the technocrats. So that might be just something for us to think about. I had a question also related to the bill that you proposed, the bill about a One Health coordination around zoonoses. And I guess as
are you referring to the framework? Are you referring to the recent framework? Okay.
Yeah.
The National One
one
Health
of the challenges
framework.
is one of the challenges that I think One Health faces is to not be seen as, oh, this is just veterinary medicine and human medicine that's limited to zoonoses. And yet that's a really important thing. What's your experience about how do we work in that zoonosis space and not minimize that, and yet not have that become synonymous with all that there is around One Health, and especially in a health securitization kind of thing, which says, Ebola is not a problem until it comes here to the US. And then we're start to get interested in it. So there's, in HIV, in the field that I worked in for many years, people were really excited to see HIV named as a national security threat because finally health was on the agenda, but it's a real double-edged sword. So what are your thoughts about the securitization thing, and how do we not get rid of, but not stay completely focused on zoonoses and the medical side?
Again, if I were giving my regular talk,
medicine or veterinary medicine.
I'm sorry, if I were giving my regular talk, you would see that I deliberately run through, I call it skipping a stone across the surface of One Health, so that I help people understand all the many arenas beyond zoonotic diseases. You're right. One of my concerns is that our lawmakers and policymakers will think that One Health is just zoonotic diseases, but there's so much more to One Health. So I think we have to be careful to frame all our comments about One Health beyond zoonotic diseases. And I kind of like to come at it with an approach of, well, what do you not get about breakfast, lunch, and dinner? Because, our One Health conversations and our relationships and what we need to be doing are one of the things that guarantee our food on our tables, and that our food's not going to make us sick. So just things like that. Instead of starting with zoonotic diseases as an intro, if you're going to do some outreach with lawmakers, start with the bigger picture. Like, here's what One Health is and all the arenas that it can help. So it's not that, so zoonotic diseases, as you point out, is an absolute, it was a driving force for this One Health movement. But over the past 15 or 20 years, we've realized that there are so many arenas that are begging for this One Health approach for us to address so many of our critical challenges. And so that's kind of how it has evolved to realize, oh, well, we need to talk about One Health and way more than just zoonotic diseases. So does that help at all? I mean, you kind of have to be sure you're reminding everybody that One Health is much more than just zoonotic diseases. Yes, zoonotic diseases really got the conversation off the ground and going, but we've grown way beyond that to realize we need it in so many other areas. You guys are already doing it on the antimicrobial resistance front. But there's comparative medicine, there's human-animal bond, and there's
Sorry, I just want to make sure to give a chance to other people to ask questions.
Because I have another question if nobody else does.
So we had the Florine Soir who was asking, what is the requirement to volunteer? How can they volunteer?
Fire in your belly and show up. I'd be happy to talk to you about what some of the things that we've got going. And when people come to me and they have a new idea for a new working group, if they have the energy and enthusiasm to lead it, we will support a new working group. We've got one in the wings now on vector-borne disease education. There's so many people that, vector-borne diseases is an area that's really, really starting as climate changes. It's becoming more and more critical for us to know how to be in nature without being afraid, just to protect ourselves, to be safe, but to be in nature. Nature is so good for us to be out in nature. So, that's one of the working groups is kind of on the burner right now. So
that's interesting because we just had last week a panel about how to communicate risks and benefits exactly on that topic.
Goodness, we need to be doing this together. I'm glad to hear you tell me that.
Yeah.
So I don't know if you recorded it, but if you did record it,
it's in French. It's in French, but
it's
the slides are available in English. So
good.
So actually, I had another question because at one point with Grézo, so that other group that I'm directing, and particularly with Caroline Kilsdon, who's in here, we tried to reach out to a politician from Ontario who was speaking a bit of the One Health, but he was really thinking of it in terms of animal rights group. So I just wanted to know what's your experience about this, and Caroline, you might want to add more. So at the end of the day, never got anywhere, but it was delicate because how do you deal with this? And I'm sure you must have come across.
Well, actually, there is a whole parallel sister movement called the One Welfare Movement. It's being led by some Garcia, I forget her first name, and she's out of Spain, and it's gained quite a bit of attention and purchase. And actually, there's a little book you guys may or may not be aware of that I've just read. It's Our Symphony with Animals. So yes, there is a conversation about animal rights. I don't usually wade too deeply into those waters on the animal rights front as far as giving human kind of rights, but I do feel pretty strongly that we've got to do a better job in our food systems. I think our food systems are going to bite us if they haven't already. It does hurt my heart the way we crowd animals together. I mean, I can't wade in too deeply on the animal rights for itself thing. This is such a complex topic. We could talk about it for hours. There are people who actually are concerned that the One Health movement is still too focused on human health. And what we really need to be thinking about is the health of the animals and the ecosystems and how that will help the humans, but not just have it all focused on human health, which is another one of my problems with us just thinking about zoonotic diseases. So if the focus were really on the healthy ecosystems from the smallest amoeba to the largest whale, and including humans in that is part of the, just part of the ecological continuum, then that's a healthy One Health conversation. But it's a really, really difficult area to work in, because you don't want to get crosswise with the animal rights people, but you also really want them to understand that One Health is evolving to really appreciate beyond the human focus. And to me, that's really important. There's actually a group right now called Just One Health, and they're focused more on equity and justice. And they're thinking in terms of One Health, but they're thinking in terms of justice. So these are the kinds of things that I learned because I work in this space, and I bring these groups forward so we can be aware of them and be aware of what they're trying to do, and then find where we have synergies and how we can do it together.
So I'll just let Caroline do one last comment, one last question, because we're out of time and I don't want to keep people for too long. So Caroline, go ahead.
Sorry, just to continue on what you were talking about just right at this point is, I find that the problem is we're trying to remove some focus on human health and make it a wider topic. And when the animal rights people come in, then we're putting the focus on some animal species and not ecosystems. So we're kind of reproducing the same problem that was there from the beginning. So that's it's very complicated issue, and that's what happened with, like Hélène said, with the lawmaker was kind of putting a mix of all these issues in the project, but it didn't. It was a private bill, so it didn't. It didn't pass.
Yeah, it still comes down to education, right? You just kind of have to keep talking and keep sharing until people understand what you're trying to say. Yeah.
Thank you.
Thank you.
Okay, I think we're gonna have to stop it now, but I again, thank you so much. This was so enlightening. I think we still have so much to do. I hope your talk inspired a lot of us here to speak about One Health to everyone.
Yeah, well, my family accuses me of that.
Right. But yeah, absolutely. But and get people. So at the end of the day, the situation we're in is caused by humans, right? And yes, we talk, and I have a feeling that recently we put everything on the back of climate change, forgetting a little bit that behind this is human behavior. Similarly,
well, that's what the whole planetary health group is really trying to bring to light. Yeah.
And then all the other issues with animals disappearing, reproductive problem, these are endocrine disruptors created by human beings. So we have to get back to what the cause is, like a good epidemiologist, and look at the risk factor and try to prevent them in the first place. But we need to talk about it. And I think, again, what the commission has been doing is bringing all these points to the table and get people to think about them. So again, a huge thank you for doing this. We'll put the presentation on the website, and I hope this is just a start of a conversation, and that we can all help. Well,
as we were mentioning before beforehand, I would love to hear a presentation about the Global One Health Network. So let me know if I can help make that happen in any way, but I would love that.
Certainly. Okay. All right. So thank you so much, everyone. And if you have any comments, please email Nancy, and she can bring the questions to Cheryl if needs be. And go have a look at the website of the One Health Commission. There's so much in there. So thank you so
Thanks,
much.
guys.
Thank you.
Enjoyed it. Bye-bye.
Bye.